Hello, everyone. Welcome to a Sunday edition of our Fireside Chat conversation, where we're diving into the many questions that we've been receiving over the past several weeks, and most frequently, questions that we're getting asked right now as practices are starting to navigate these uncharted territories as they're preparing to open their doors, or maybe they've been back to work already for a couple of weeks, depending on your province and your state. So we're here asking all of those top questions that we've been getting asked over the past few weeks. So I'm Samantha Leonard, the CEO and co-founder of Stream Dental HR, and I am here with Dr. Sam Dar, who is also the co-founder of Stream Dental HR. He's an international speaker, key opinion leader with Invisalign, but he is also a practicing orthodontist. You own your own practice. You're going through this yourself personally right now. So a lot of the things that many offices are going through, you're going through that right now too, right, Dr. Dar?
Correct. And then thank you, and thank you, Olivia, and thank you, Samantha, for being here today. I figured we're gearing up. So today, I'm not speaking as a co-founder, but actually as a practicing orthodontist, as a business owner who has plenty of questions, right? So I know, Olivia, you've been very patient and helpful. Thank you. I actually, just like everybody else, purchased a service and I'm using it. So I'm going through Olivia as we're opening the practice next week. So Olivia, what I did is I prepared 12 questions for you. All right. I think I might have asked you a couple of those, but the other 10 or so are brand new. So I hope you're ready for this. So we're going to go through this. I have some questions that I actually wrote down. I need you to help me understand. A lot of my colleagues have actually reached out to me knowing that I own an HR company and asked me questions. So most of these are mine, but just keep in mind that they're uncommon with other questions. So Olivia is our star team member. She's been helping us quite a bit. We work with a team in the US as well. So, but Olivia has been extremely helpful as an HR person, manager, and HR everything actually. And I just want to add one little caveat before we start. Is what we do here is we sort of mix. You might hear some of the answers. We mix sort of employment with business sense kind of thing. So it's more than just simple employment law. We urge you to, once you hear these questions, depending on which province or which state you live in, maybe check with your employment lawyer before you take the last step. But here we're giving you guidance, we're giving you advice, and again, we're mixing employment with business common sense. So let me start with some of the questions. Are you ready, Olivia?
I am ready.
I wrote them down. So here I am. So I'm recalling my staff. Next week, I'm recalling everybody. How do I bring them back? How do I choose who to bring back? What if some people decline a recall?
Yeah, that's a great depiction of a situation that so many practices are dealing with right now. Truthfully, you really can bring back anyone that you think should be coming back as long as you have the sound reasoning to do so. So general recommendations, either bring back based on seniority or bring back those that are able to provide the most value to the rest of the practice. Maybe they're cross-trained or something to that effect. But most importantly, you need to communicate that with your team. So we're recommending to keep up constant communication with everybody and see who's the most anxious to come back to work, see who financially really needs to come back to work. This is one of those times that we don't have previous precedents to base our decisions off of. So it's vital to truly just talk with your team, let them be a part of the decision-making process if that's possible. Then, once you determine who you will be bringing back, you should issue a recall notice in writing to your staff that will be returning within a week of the recall letter being sent out. Okay. So in the recall letter, you should let your staff know that some temporary changes may be taking place while we recover from this pandemic. And that could look like longer work days. They might have a reduction in overall hours, or there could be some temporary role reassignments to help to cover the needs of your practice. And then, of course, you need the employee to respond to that recall notice in writing to either accept or decline the recall. So now going back to your question, if an employee accepts the recall, that's super straightforward. We need to consider what to do if they are declining the recall. So we need to ask them, are they declining the recall because they have some protected or some valid reason for doing so? Are they caring for kids at home and they don't have childcare, they don't have school? Are they immunocompromised, or are they living with someone that is immunocompromised or in a high risk category? So if any of those questions, if the answer is yes, then we need to make sure that we're making accommodations to ensure that the employee is able to take care of their family and home responsibilities while also notifying their workplace adequately. But
No, what I wanted to ask you is, and there is actually a situation like that. I'm a little bit uncomfortable asking because two of my employees are sort of medically compromised, a little with a
Mhm.
compromised immune system, I should say. Where do I find that line? I don't want to sound like I'm imposing, but at the same time, I really do want to help, and I want to do what's best for them at the same time. Is it okay if I ask that question?
Yes and no. So in providing the recall letter, they're going to have the option to either accept it or decline it. And if they
Okay.
decline it, then we're going to ask why. So
Okay.
then that would be the point in time where they're going to tell you that they're immunocompromised or something like that. And you don't have to ask any other questions.
Okay.
You might say, can you provide me with a medical record or a note that provides me with the support that this is a true statement?
Okay.
You're more than able to do that, but you don't need to dive any deeper into the personal situations that they're in.
Okay.
Yeah, but then something else that you do need to consider too is that you might have employees that decline the recall without having a valid reason for doing so. So again, what do we do in that situation?
Yeah.
We ask their reasoning. If the employee says that they're just scared to come back to work, then we need to make sure that we're conducting a hazard assessment and show the employee that the risk within the workplace is super low. Then after another conversation, we're showing them the outline of our hazard assessment and our investigation. If they still don't want to come back to work, then you have a choice. So if there's another employee that you could recall next in their role, you can recall that employee in and give the employee a little bit more time that they need to feel comfortable to come back. Or if they are really the only person that can fill the role, then you probably have no other choice but to let them know that they are being formally recalled. And if they still choose to decline available work, then we'll be taking this as an effective point of resignation and we'll need to look for a new employee to fill the role.
Okay.
And I
Okay.
think it's
Go ahead.
really important, just to kind of piggyback off of what Olivia had mentioned, is that this recall notice should not be verbal. It should be something that is in writing. So in that way, you have that documentation that if somebody is declining for what reason, or if they choose to accept,
Mhm.
also making sure that in that recall notice, you are providing that substantial information that you have been taking the steps
Yeah.
to keep them safe, right? So this is why now is not the time to be doing anything verbal. We want to make sure that we've got all of our I's dotted and T's crossed,
Yeah.
because there's a lot at stake right now.
Perfect, Samantha. So that's a good question to follow up. Writing, can that be in the form of an email? A well-structured, clear email. Is that enough?
Yeah,
Because that's
absolutely.
how I've been communicating with my team members, either through email or a couple of Zoom calls. But 18, 19 employees email, and everybody has been getting them because everybody's been replying. So can I assume that this is sufficient then?
Yep, absolutely. Because we're not at the point where we're seeing everybody face to face, so it doesn't make sense to give them a physical copy. So yes, you can send one registered mail if you wanted to, but email is sufficient.
Perfect. I appreciate it. I hope you guys don't mind. I'm taking notes as you speak.
Please
So
do.
my next question. So we're not going to see as many patients at the beginning, at the start when we first open up. Can I reduce wages or can I reduce working hours?
Okay, well, standard HR response that you've probably heard a few times in the last week from me is it depends.
Okay.
So it depends what province you're in, and of course, the terms that are listed in your employment agreement and your employee handbook. So in some provinces, you can actually reduce wages,
Okay.
whereas in other provinces, you can't. But a better way of reducing your staffing costs for the short term would probably be to just reduce the employee's hours slightly if you can. So
Okay.
again, this will depend on the terms of your initial agreements and if there were any guarantees of hours or guarantees of wages or anything to that regard. And
Okay.
like all HR processes, like Samantha was just saying, documentation is key. If there are any temporary changes, and I truly mean temporary changes,
Yeah.
that we have a strong upcoming reevaluation date, you need to make sure that the employees are agreeing to the terms in writing. So for example, given the circumstances, if we were open 6 days per week beforehand, we might only be able to fill 3 days per week now. In booking these cases, we're not going to overlap. We're not going to dovetail. We're not going to do any of those sort of procedures so that we can make sure that we have time to sanitize and disinfect the ops before they're used.
Okay.
So if we're going to bring back maybe 35 to 50% of our staff during this time, and we're only working 3 days per week, then we want to make sure that it's agreed to in writing for the temporary term. And we're going to say in 6 weeks, we're going to reevaluate this and see if we can add in more hours or more days or what have you, so that the employees have very clear understanding of what working under these conditions is going to look like.
So, and maybe Samantha, you can also jump in on this. How about what is the flip side to that? Let's say I open 4 days and I decide to open 5 or 6 days because I see less patients per day. So I want to be accommodating to our patients that have been waiting for us for 3 months. Some may have emergencies, some may be at the end of the treatment. the flip side to that, can I also ask him? Do I just simply ask him to see who volunteers to work the extra hours? Can I? But that makes my life as a business owner difficult because I have to put a schedule together, and some
Mhm.
of these team members come together as a team. A hygienist, an assistant, and a receptionist sort of come together as a team. So if I have 7 hygienists but no front desk, that doesn't help me. So where do I stand on this? How do I handle that?
Well, I think definitely communication is really important and getting your team involved to a kind of know how are we triaging these patients? Who do we need to recall back first? What does the schedule need to look like? How long should we be booking these appointments and buffer time in between? So really just almost it's a business strategy that everybody should be involved in. So in that way we're coming up with different ideas, we're coming up with different solutions and then being able to plan accordingly. And when we do that, then we actually get their investment in there as well. So they're willing to go the extra mile. They're becoming stakeholders now in the practice and working with you to be able to make sure that we're reaching our benchmarks, we're hitting our goals, we're getting back to where we used to be. And then again, making sure that that is all written down. You're probably going to hear that like every single answer that we provide, but it's just making sure that everything is in writing. Even if we didn't have employment contracts to begin with, even though everything maybe was a verbal agreement, that is still a contract. So that's something that we need to remember, that anything that changes needs to be in writing.
Okay, perfect. I appreciate that. So now let's continue along the same thought. So when production picks up a bit, how will I know when I should bring back more employees and which employees again? So what do I determine that based on my on my production, on us being sort of used to the new norm and being capable of accommodating more patients? Is that, or what should I base it on?
Yeah, that's precisely it. Is when you're kind of creating those benchmarks, is we really have two primary methods that we can use. So like you said, either cash flow from production or when there's patient necessity to do so. So
Okay.
this is obviously going to be a specific metric that needs to be calculated for each practice. But if you're able to create those benchmarks for weekly goals that say, let's say once we hit this point, then we have the resources to bring back another employee in this role, or maybe we have another role that we can bring back into the practice, or maybe once we have this many patient procedure hours booked per week, then we can bring back another employee in this role so that we can fill those hours. But overall, this is going to be a really practice-specific metric that needs to be calculated and revisited on probably a weekly basis while we navigate back through this pandemic and getting back to full operations.
Exactly. And I think that's why the same thing is we don't know what this is going to look like. It's probably going to vary from week to week. Everybody's situation definitely is different. So again, the communication side, setting those benchmarks, but also being able to do some what we're calling debriefing with your team at the end of the week of seeing, okay, let's take a look at the schedule. Let's see what worked, what didn't, what do we need to do for next week? Maybe we do need to add an extra team member, or maybe we do need to extend our hours. So in that way, we're constantly having those conversations, we're adapting, and then using the necessary, documentations as well. For if we do need to bring somebody else back, do some job sharing, extend hours, what have you, we've got all of those things down and in agreement. But, setting those goals. If we didn't have KPIs, if we didn't have metrics before, I would definitely say start by looking at, what our expenses look like every single month. What's our, bare ass minimum that we need to be producing to be able to make ends meet, and then setting some strategic goals like Olivia was mentioning, week after week, what month 1, month 2, what we should be aiming for, and then really kind of using identifying our and maximizing those opportunities of seeing maybe we've got some great Invisalign cases that we've been doing before in the past. That's not aerosol producing. So why don't we have a chair blocked off where we're actually doing Invisalign consults or maybe doing virtual consults? So definitely finding different ways on how we can, maximize our opportunity during these
Okay.
times.
So let me ask you as these questions go through my mind, let me ask you the opposite. So let's say I bring back 70% of my staff, and then a week or two into it, I realize I'm overstaffed just because what's on paper is not really translating to reality, kind of thing. And I realize I may, I'm there's 2 employees, for instance, that are really I can do without. At that point, can I turn around and say, you know what, thank you, but can I can I ask you to stay home until we pick up a little bit more? Is that an option?
Definitely an option, not a good way to go if we can avoid it.
Fair
While
enough.
they're on a point of temporary layoff, then they're already used to that, and then we
Correct.
can issue them back in quickly and progressively, right?
Mhm.
But if we're calling them back, they work for 2 weeks, and then we put them on layoff again.
Yeah.
We also need to look at the eligibility criteria of things like EI or the CERB and how that's going to be affected by them returning to work for a couple of weeks and then being laid off again.
Perfect. So on the side of having less employees, and then it's easy to recall them if
Exactly.
need be.
That's
Okay,
what I
thank
would do.
you.
Yeah.
Perfect.
Yep. Slow
Now,
start.
you already touched up a little bit about some patients being nervous. So let me take you sort of in the in between, in the twilight. Some of the employees are really nervous, but they haven't said no. I don't want to come back. You sort of get bombarded by 7, 8 emails an hour kind of thing, asking about everything, even though we have everything in place. And then those employees, you can tell, you can feel, you know them, they're still nervous. Is it okay if I sort of calculate, well, since I need to bring back 60% of those employees, can he or she be one of those 40% that maybe I keep laid off for now? Is that a good, valid question?
Validity of that is something that I would have to look at the more specific situation and really dive deeper into that to give you a good answer. But again, that just kind of goes back to the open communication. So letting everybody know that they can communicate with you, even though you're getting 7, 8 emails a minute, it seems. But even just booking some times for phone calls, and just so you can really check in and see, because at this point in time, we need to be really mindful about the psychological hazards that
Correct.
are going to be within the workplace,
Mhm.
even more so probably than the biological, chemical, and physical hazards that we're used to. So many employees are really going to be nervous and anxious about coming back from the pandemic. And they might not know that they can come to you and they can talk about these things. So even in like the health screening procedure, when they're coming in, they're getting temperatures tested, they're saying that they don't have any symptoms. What we've also seen and what we're recommending is just a very, very simple mental health check. So anything from a rating scale of 1 to 10, you've probably seen them with like 1 is the emoji face that's super distressed and looks terrified, and a 10's like got stars in its eyes or something like that. Even just checking in and seeing what level they're in between that 1 and 10 is going to be important, so that you can follow up with it. Because overall, as time passes, the PPE requirements, just that progressive donning and doffing procedure, it wears on the mind, and they're going to get fatigued. So keeping a constant kind of touch point and see how they're doing over a period of time is going to be really important.
Perfect.
And I think too, just adding on that is just, we don't want to forget that, especially at the beginning, we're doing these trainings again, where we're kind of refreshing what the new interim guidelines are and the new protocols. But we want to make sure that we're doing that on a weekly basis, that it shouldn't just be a one and done. It should be, we've got these new protocols, we've written it down. Let's go through that again, maybe have a monthly checklist where we're doing a hazard assessment on our practice with the team. We're going through these protocols together. So in that way, we want to make sure that it's top of mind. Our due diligence that we're doing to keep the team safe, to keep our patients safe, and most of all, keep their families safe too. So just making sure that this all kind of works together, because that's also going to give them the reassurance. And we want to remember that your employees, they're not just, working for you, they're your brand ambassadors. So it's your responsibility as the leader to keep them engaged so that they can continue being your biggest fans, raving fans. And because they're the ones who are going to be showing that and making the patients feel that way when they come in too.
Okay, well, this is a nice segue to my next question. There's no denying that we live in a litigious society, be it in Canada or the US, right? So what can I do to mitigate the risk of potential future lawsuit as I go through this? This is, you mentioned it, Olivia, it's unprecedented. So it's not, I don't have, railings, I don't have guidelines as to what to do. So I'm using my conscience, my common sense, and as much as I can, sort of the law. But what can I do to mitigate that?
That's a fantastic question right now. And the first thing I'm going to say is that if you feel like you need a lawyer or legal representation, then you probably already do.
Okay.
But beyond that, the best advice I have for protecting yourself and your business through the recall process is to make sure that you're just consistently staying up to date with your provincial employment standards legislation, which, I mean, based on the last couple of months, definitely easier said than done when the legislation is changing, seems like every other day.
Correct.
But overall, just make sure that you change any policies or procedures before you do so, you got to make sure that it's lawful to do so and that the policies you're putting in place aren't breaching any employment standards legislations. And then, of course, once you've determined that you're compliant with all the policies and procedures, you want to ensure that you're documenting everything, like we have been reinforcing throughout this entire conversation, because we need to keep those good records in the event of any future investigations.
But Olivia, this is like, this by itself is a full-time job. So here I am, I'm trying to keep an eye on my practice, on my patients, on my staff, and keeping an eye there on what the guidelines, what legislation is. This is where I got lost. I mean, luckily I have you ladies to help me with that. But is that the best way to do it? Is to rely on you for something like this? Because there's no way we're all stressed, and that includes me, the boss, about all these things. So the best thing to do is, is that something that you do that you can keep an eye on and then keep me informed, what happens in my province, kind of thing?
Absolutely. Absolutely. And that's what we strongly recommend too, is you're a professional in what you do and we're professionals in what we do. So let's work together and let's support each other through this so that, again, we want to make sure that our clients are not going through any undue stress and that they're not doing anything that's going to be litigious, like you said. So that's kind of the overall guideline there.
Perfect.
Yeah, and just like you mentioned, Dr. R, I remember, when we worked together, right, managing those 6 offices across the country, you hired me, and my background was a dental assistant. I didn't have an MBA. I didn't know anything about employment legislation.
Yeah.
So there was a lot of these issues.
You're the expert now. Look at you.
The irony, right?
Yeah,
but it was just, so many of these things that I didn't know until it was an issue. And by then it was a little too late. And now I spent all of this time trying to fix it, trying to put policies in place. And, I'm just being retroactive there. And that really took us away from what we needed to do to grow the company. So, if anything, we just want to make sure that when we're working with our clients, like Olivia mentioned, we take care of that aspect. We help them go back to being a dentist, and we take care of their HR needs. And that's what they should, be focused on right now.
So I want to say something. I'm just going to digress for a second for our listeners. Samantha used to be my employee 10 years ago. That's how we met. And she became my operations manager. And I'm so proud of her because I know she will never toot her own horn. And she's come a long way. And she's to a point where she's my business partner. And I'm so proud of you. I just wanted to mention that. Thank you. Let me ask you the next question.
Now. Thank you.
Olivia, and this is specific to me, but I'm sure other doctors have this. I don't actually presently have any contracts to any of my employees. Can I issue new contracts right now? Is this a good time?
Is this a good time? No. It's definitely a bit of a sticky situation. Again, the answer is yes and no. I personally wouldn't recommend putting any new contracts in place right now since everything else is already so up in the air and people are anxious enough about this entire pandemic situation. So we don't want to make it any worse.
Good.
However, you could technically put in some physical contracts in place if you absolutely had to. Like Samantha said earlier, a verbal agreement is technically just as binding as a written contract. So in order to actually implement a different type of contract, you would need to provide something as adequate consideration to your employees. And there's a good chance after you've been closed for 3 months that the financial ability to do so is going to be really limited. So you can absolutely start to implement written contracts with any new hires that you have as they join in the future. But I'd be very leery right now of implementing any new contracts with your staff members coming back to work at this moment after a period of temporary layoff. So after a cool down period and production starts to get back up to status quo, that's probably a good time to begin to discuss with a professional how to actually implement a physical contract into the employment relationship.
So Olivia, even if the intent is actually good, it's because it's really for their benefit, right? So, I hate to use the expression, but if I get hit by a bus tomorrow and that verbal agreement is between me and one of my employees, having it written down, I mean, we're not changing anything. We're just putting it down. So in my mind, I got that answer wrong for sure, because I knew, but I thought that this would actually be a good thing because it would have been meant in good faith. So let me ask you sort of a follow-up on something you and Samantha already mentioned. There's so much information out there. How do I know what I need and what I don't need? I mean, you touch up on that. I know our company takes care of that, but how do I stay on top of it on a daily basis?
Yeah, so that's an awesome question. And I think the best place to start would be to ask yourself always, what are the minimum legislative requirements in regards to employment standards for my region? And then from there, you're going to create the appropriate documentation to support these requirements for your employees. But I want you to think about this for a second. I personally am not a dental practitioner. I might have a toothache and start to Google my symptoms, and I might have a very general idea of what's going on in my mouth. But then I go to you as a dentist and you take a look, and within a quick diagnostic exam, you're able to provide me with an entire comprehensive treatment plan that will take away my pain, repair any structural issues, and then I go on my merry way. Now, that right there is what I do for all of our clients. I do something called a compliance check, which is like the HR equivalent of a diagnostic exam. And then I use this information to provide you with guidelines for what you need in regards to getting your practice to be HR compliant ASAP. Okay. So a large majority of the time, the practicing dentist owns the dental practice, like we had already mentioned. Yeah. And while they may be a phenomenal dentist, they're not an HR pro. And then when crises like this pandemic take place, and HR becomes an absolutely vital lifeline within the practice, it's virtually impossible to not get stressed out because it's not your field of expertise. Yeah. And it's okay to feel like you have no idea where to begin. And that's precisely why I would not perform a root canal on myself. Right? Like, it's just crazy.
Yeah.
But just a place to start, look at the training you have, the manuals, and the documentation that you have within the practice. And that's usually a good place to begin. And then from there, we can take a deeper dive with you into doing a full compliance check on a one-on-one session that won't take more than 15 or 20 minutes. And then we can really kind of create that practice specific plan that you need for HR.
So I hear the word delegate in here, which as a doctor, I love to hear. Perfect.
And I definitely, and this is another thing that we've been seeing as well, is that sometimes, practice owners have identified that, okay, I've got some big holes in the business when it comes to not having an employee handbook or any HR documentations. And so what ends up happening sometimes is they'll copy and paste. They'll go on the internet, they'll Google what this policy is, and then start creating their own handbooks. And there are many times when Olivia and I and Isabel, we've been doing an HR audit, and we start to see illegal policies that contradict each other. So this is, like Olivia said, we wouldn't want our patients to go home and do their own root canal. We don't want you to go home and try and do your own Googling and putting together your own employee handbook, because at the end of the day, it doesn't benefit anybody.
So Samantha, let me add to that just a little bit. So I know I also hate Dr. Google, because when patients come in, but I read on Google that I don't need a root canal, I need an extraction, right? So we all suffer. I've been suffering with that, unfortunately. But one of the other things that I actually came across from colleagues that call me, they copy paste, not realizing there's 50 states and there's 10 provinces. So if you pick it up from the wrong province or the wrong state, then you're doomed as well. And the other thing, and this is what I have to tell you, and you probably know this, I'm sure you heard me, our software, the software that we created, has been so helpful just categorizing everything. I never realized, I was always excited about the software that we created, HQ, but putting it all together, sort of being able to just go straight into the document that I want and you downloading what I need straight into it has just been phenomenal. And I really want to admit that has been time consuming and has decreased stress. And, I'm not a software expert. We hired people that do that, but I'm grateful for that. So thank you. Now, speaking of stress, where do I start? We're opening next week. We're doing this, we're doing that. I'm the leader. Everybody's looking to me for direction. And pretty much, I think I have my head screwed on straight. But you know what? I don't tell you at night. I don't have, moments of doubt. And sometimes it's hard to know where to start. So where do I start? How do I start?
That is a fantastic question. It, really, like I said before, looking through your documentation, so seeing what sort of training manuals you have, your employee handbook, your occupational health and safety manual, where are you keeping your MSDS? Where do you have your emergency procedures binder? Where do you have your infection prevention and control standards? Where do you have your privacy policy? Where do you have your new PPE guidelines? So basically consolidating everything into one place. That's going to be step one to try to mitigate that stress. And then from there, contacting someone like us to really just kind of walk through everything with you to make sure that it's all lawful, it's all as it should be, it's all compliant. Because like you were saying too, not even so much if we pull, let's say I'm in BC, I pull a policy from another company in BC. Did they make that policy 5 years ago? Was it 10 years ago, 15 years ago? Was it in February? Because now they're probably even then need to be updated. Right. So yeah, just coming through and making sure that we are working together to make sure that you are compliant and that you know where you're going. That's going to help to mitigate that stress, because you've got enough on your plate. You don't need to be dealing with that either.
Yeah.
Yeah, exactly. And that's why we created the company, right, Dr. Dar, is
Correct.
just
That was the reason for it in the first place. So, and again, I keep adding footnotes, ladies. The company was started actually 6 years ago, way before COVID. I mean, its value has materialized right now, and maybe it sort of shined a light on what we do and the need for a service like ours to most of our colleagues. But we started this 6 years ago. We saw the need for it. We personally, Samantha and I actually saw the need for it, and that's how it was born in the first place. Now, let me ask you next question is sort of a little bit of a business sort of with HR. So I'm concerned with the productivity of my team and my team culture once we get back. I mean, we've all been distant for 3 months. We've communicated, and now we're all coming back. How do I deal with that?
Yeah, that is a fair concern during this
Yeah.
time. You need to remember that, things are going to be different for a while,
Yeah.
and your employees need to know this as well. The
Okay.
structure of the practice is going to be a little different, and it's up to you as the leader to reassure your team so that they are actually they understand that you expect things to be different,
Okay.
so that they don't feel like they're implicitly letting you down through the whole process when they see that production levels are down or they're not getting as many patients in, because it's all something that we don't have any control over. So your team needs to be reassured that it's not up to them to, make magic, really, because we're just coming back from this the best that we can.
Yeah.
But now your culture could actually be affected by putting in any new policies and procedures, and that makes it even more important to remind your team that when new policies are put in place or we're standardizing procedures, that it's not always due to the fact that you as the practitioner or the business owner, that you don't need something physical to enforce. So the whole reason for putting these policies and procedures on paper is to just provide your team with more consistency and mutual expectations so that you know what you can consistently expect from them, and that your team knows the same that they can consistently expect from you. So one of the most toxic aspects of negative organizational culture is inconsistent information and communication.
Okay.
So if you can utilize the process of putting policies and procedures in place within the workforce as a way to positively support your team, and you explicitly tell them that this is why you are doing these things,
Mhm.
then you're way more likely to have success in the process overall and less fundamental changes to your initial organizational culture.
And that kind of reminds me about a conversation that we had with a client earlier this week, Olivia. I remember she'd mentioned about how she informed the team that they were starting to work with us, an HR firm, to be able to help them because they didn't know where to begin and what all the things that they had to do with all the changes.
Yeah.
And so their team actually said thank you. They were appreciative that they are working with a company to be able to help them navigate these uncertain times. And really, ultimately, it showed that they took the initiative to do what's best, not only for the business, but for them as well. So that also, to Olivia's point in regards to having all of those expectations, it just puts everybody at ease because we're coming back in the middle of a pandemic. We've just got these new interim guidelines, a couple weeks ago, maybe last week, for example, in Ontario. So it's just now, everybody wants to have that sense of reassurance. So, having that is really helping along with that.
So, and I'm trying my best here. So I do get a lot of questions from staff, which is understandable. We've had a couple of Zoom meetings with the whole team, but also with the doctors separately, communicating by email, some of them phone calls. Am I doing the right thing? Is there any better way of doing it? So how do I best communicate their questions and concerns?
Yeah, well, first of all, it's really great that your staff are communicating openly with you. And even though sometimes it can feel like it's too much communication, it's way better than if they were keeping things bottled up. So really how you want to answer their question is truly up to your discretion. My general recommendation is one-on-one conversations are probably the most effective way to go, and use phone calls or Zoom calls if you can't schedule one-on-one time in person. That's definitely going to be way more effective than texts or any mass emails or anything like that. But in doing so, we also need to pay attention to the content of the questions being asked. So if you have 2 or 3 employees asking the same question, there's likely others that have the same question. And in that case, it might be more important to have a group discussion just so that you can clear the air with everyone. But as with any group discussion or staff meeting, highly recommend setting a strict time limit and a strict agenda for the meeting so that it doesn't turn into a complaint fest, and that you can address all of the questions and concerns being asked. But overall at this point, like you're already doing, we see practice owners and they say, well, I'm too busy. I don't have time to talk to everybody one-on-one. And realistically, we're all busy. We're all trying to figure out how to navigate through this. So that line is just a waste of breath and a terrible way to damage the relationships that you already have worked so hard to build. So answering their questions usually only takes 2 to maybe 3 minutes at a time, and it will preserve your culture. So even if it takes a total of an hour or 2 out of your week to respond to your team effectively, it's worth every last minute of time and effort you've taken so that you're ensuring that your team stays strong during this pandemic and so that they stay strong during any other future crises that may happen within the practice.
Just as an aside, I mean, you said 2 to 3 hours a week. It's been 2 to 3 hours a day for me, which is fine because, I mean, everything has a silver lining. One of the nice things is you actually get to know your team members, because when we're all under stress, they're under stress, I'm under stress, and you get to see, you get to know them a little bit better, as a matter of fact. So for better or for worse, you do get to know each other a little bit better.
Exactly.
So now we're talking about patients. I wanted to switch to patients. Same thing. How do I best communicate with my patients? We're an orthodontic office, so we have a lot of active patients all at once. What is the best way to communicate with them?
Yeah, so patient communication has to happen a bit differently than employee communication, because your employees need to know the ins and outs and the why behind each policy and procedure so that they can effectively communicate this to your patients. So the first thing you need to do before communicating anything to your patients is, of course, make sure that you have a united front within your staff so that your patients aren't ever receiving any miscommunication. But something that we've noticed is really effective, sending an email blast to all of your patients with a video of yourself or the office manager or someone within your office walking through the safety guidelines and the new procedures within the office. Because realistically, people are only ever going to skim through like a 5-page email. Even those of us with the best intentions of reading the entire document get sidetracked into some other thing and likely forget to read the rest. But if you send a 3 or 4 minute video explaining the protocols and walking your patients through what it looks like to be a patient at your office, that is something that's going to hold their attention. And realistically, we all say a picture does speak 1,000 words. So your patients aren't going to waste any time trying to remember what the layout of the office is when you're describing one-way traffic flows, because you can actually just physically show them. And then this again is going to reiterate that consistency of your message, because again, we're not relying on a variety of different people to get the message across. It's one source, one video, one clear message. So that's what I would recommend to do during this time.
Yeah, I love that idea. And especially like you were saying, I could read that email and it interprets one way to me. And then I come in and all of a sudden now I'm confused because I'm being told something else. So again, that's the trust factor that we need to remember. We've built these great relationships with our patients. We want that trust to continue building over this, going through these crazy times together. So having that video, I feel like, is a very, very powerful tool that we could be using. And then along those lines, we could also be using that for our training tools for our team. So creating videos on how we properly don and doff our PPE and how we sterilize things from now on, because the same principle applies. I'm a skimmer. I will not read a full-on document. I will read in whatever point
Yeah, I
stand
know
out
that,
to me.
Samantha.
Yeah, that's why
I wasn't going to say anything.
So that's why video is the best.
Yeah, I mean, I was thinking of putting a phone booth in there because I've seen Superman, just go in, change, and go out in a split second. But I figured that wouldn't be enough. So let me ask you, as we taper down these questions, Olivia and Samantha, how do I take a pulse check with my team? Like, how, keeping in mind, I'm in a different province, right? So, which again can have its added challenge as well. So how do I take a pulse check with my team then?
I love questions like this because it really shows initiative from the practice owner and shows that they truly care about their team. So in this case, first thing you can do, which obviously is already happening, is keeping clear communication up within your team. So just asking your team daily when they're coming in and doing their health screenings, how they're doing, how's their family doing, do they need any support? Or like I said earlier, having that quick mental health check with the emojis. So from a 1 to a 10, which emoji are you today? If you notice that, an employee says they're a 2, at lunchtime, maybe check in with them, see how they're doing, see if there's something going on or something that you or another team member can provide them with some support. That's usually just like keeping a day-to-day sort of check on this thing. You don't want to let it go for weeks and weeks and weeks, because that's when things get really toxic within a practice. So usually just having a listening ear is enough for the employee to let you know whether there's an external issue or an internal issue, and to what severity the employee is being affected by that issue. Because during this time,
Sorry, I was going to say, I think daily might be a little too much. You understand, they're all stressed. It's been a
Yep.
long day for them. The last thing they want to hear is see a ding from their boss or an email from them. So if I say twice a week, would that be sort of a nice balance? I think leaving the door open for them to reach out at any time they choose
Mhm.
to, obviously.
Yeah, absolutely. I'd probably recommend doing like a Tuesday, Thursday, not necessarily a Monday, Friday, because
Yeah,
Fridays we're usually pretty excited and Mondays we're not very happy to be anywhere.
yeah,
But doing things like that just show that compassion and empathy, because bringing your employees back to work, they've got families, they have other responsibilities too, and we need to be compassionate and empathetic towards them throughout this whole situation.
hmm
Yeah. And remember, your employees, they want to feel heard, seen, appreciated, and safe. And so, what are we doing actively to make them feel that way? Because we can say, my door's always open, but that person may not take the initiative to come and address something. But maybe when you take the initiative to say, how are you doing? How's the week going? Are there any obstacles or challenges that you're facing? Just asking a few short questions can create that dialogue, because they feel that, man, you took the time to actually see how I'm doing and
yeah.
feel, get my input on something, and they'll be more likely to then start opening the doors and coming to you. But we kind of need to set that precedence first and set the example first.
And to build on that too, this is not a short-term thing. This is going to have to go on for weeks and weeks and weeks, because realistically, our human body, it was only created to handle extreme stress for fight, flight, or freeze, all things that are supposed to be short periods of time. So I'm sure everyone's felt the same response. Those first couple of weeks of the pandemic, it was like 3 to 4 weeks where we're just going on. We've got that adrenaline. We can feel it coursing through your bodies. And then I know personally, I crashed after about 4 weeks of that.
Yeah.
And the end of the pandemic is still not clearly defined. So you're probably going to notice that when your employees come back to work, and they're going to have a few weeks where they're efficient, they're donning and doffing like pros, they're keeping clear records, they've got good health screening, they're like lean, mean, cleaning machines in the practice. And then that fatigue is going to hit, and it's going to hit like a ton of bricks.
Yeah.
And that's going to be the point where it's even more important to show that compassion and that empathy, and continue to have those open lines of communication, have those weekly or biweekly staff meetings, keep doing those mental health checks. All of that is going to be so much more important in the long run than even just in the short term.
And who pampers the boss then?
Right?
In any event.
It's true.
Well,
It's
but
true, though.
I
I think it goes a two-way street, right? The
correct,
team
correct.
also, needs to realize as well that this is, being a business owner, the weight of the world is on your shoulders, because you're thinking, how am I going to pay the bills? How am I going to pay my team? How am I going to pay my family? How am I going to do this? So there's definitely a lot of stress on everybody. So as long as we show the empathy, it's not just my boss has to do this. It's a two-way street here. This is a two-way relationship.
Okay. So my last question, which it just sort of came, it wasn't even on the list. So what do I do if there's a COVID exposure within my office? Like, how do I best handle that?
Oh, that's a great question. Well, obviously, we're going to keep our fingers crossed that never happens, but good to create that plan,
Yeah.
because we definitely need it.
Okay.
So creating that exposure response plan, and the first item that you need for that response plan is going to be an identification of the risk areas where employees may become exposed to the virus, and then obviously providing training to those employees. Then we need to determine what your contingency plan is dealing with. So in the event of a COVID exposure, you're going to have workers that are absent more frequently. So what would you do if you had an employee that was off work for 2 weeks because they were in self-isolation? Or you might have 3 or 4 that are off at the same time based on exposure. So we need to continue to plan for physical distancing, and can we maybe cross-train some of our staff so that they can jump into a different role if there was an exposure in the practice where people had to be away. Another thing that we need to consider is what sort of a stockpile do we have of supplies? Because what happens if our supplies or deliveries are delayed due to a COVID-19 exposure? And what sort of PPE or other materials, what do we need for the practice? How many days do we currently have? When's the next supply coming in? So we really need to build that contingency plan for our materials as well as our people. And then, of course, we need to have this plan in place before an exposure happens, because if we're just putting it in place when an exposure happens, then we're already too late. So then if an exposure was to take place within the office, we need that clear plan of action for tracing and tracking the contact that the person with COVID had with anyone else in the practice. So you need to determine how you're going to notify any patients that had contact, how you're going to notify any staff that have had contact, any suppliers or vendors or delivery people that had contact with this person. And as well, assuming that if you receive notice that someone in your office has had or has COVID-19, they have likely received a diagnosis from a medical professional. And therefore, we will just confirm with the person that in this case, we don't have the responsibility to report the positive or the presumed positive case to the CDC because it's likely already been reported, but still very important that we discuss this with the infected person so that we know what we are responsible for doing as employers. We also want to make sure that any employees that had contact with the infected individual are going and getting a COVID-19 test done so that we can find out right away if anyone else has been infected. We need to contact the cleaning company, get a full disinfection and sanitation of the office. And then, of course, depending on the specific situation, you might need to contact workers' comp or the OHS, depending on whether you have any employees that have contracted COVID-19 directly from the workplace. And of course, we would be able to determine this once a full tracing protocol was completed.
Well, that's a nice question because we assume that we contacted or our employees may have contacted in the office, but there's sort of a flip side to that. What if they're the one that actually contacted outside the office and brought it into the office? What happens if an employee passes it on to a patient rather than the other way around? So that's where it gets a little bit murky. And I want to make sure that nobody places blame because it's not about placing blame. So, staff may get agitated, upset, so on and so forth. But it could very well be them being the culprit in the first place, getting it from a neighbor, from a friend, from a grocery store, and bringing it over rather than them getting it from a patient or from a colleague. So this is where tracing becomes important, I guess, at this point. So what I would do is I would caution everyone to not to point finger or put blame on anyone. Just deal with the situation because no one, you can't say that we broke the barrier and we got this from a patient because these patients are being tested before coming in. They're getting questionnaire, we're getting their temperature taken as well. So it will be hard. It is an invisible enemy, and we don't know where it's coming from. So I just wanted to actually comment on my own question because as you were speaking, these were coming to mind as well.
Absolutely. Well, and it all comes down to doing your due diligence and showing that you're not negligent in the case, right? So as long as you are doing everything in your power, if it happens, it's truly an accident. We need to be able to prove that in an investigation.
Yeah. And then another thing too, of what Olivia had mentioned is just the same way that we had our protocols for making everybody feel safe. We also need our emergency protocols, right? So the same way, I think, Olivia, there was an interview that we did a few weeks back kind of talking about fire drills, right? When we were in school, we knew that there was a chance that there could be a fire, but we practiced the drill. Everybody knew what had to happen the moment they heard that sound, the drill go off, right? So it's the same way. We need to have a practice scenario, a drill. So in that way, if there was ever a likelihood that our team or our patients were exposed with COVID-19, we've got our go bag, we've got our action plan, and we all can take part of all of the necessary steps. So we're making sure that we're compliant with that factor, right?
Correct.
Absolutely.
Correct. Perfect. So now I'm all fresh out of questions. Any last advice you ladies have for me? Again, not as a sort of a stream dental owner, but as a dental office, as an orthodontic office owner.
Yeah, and I know I've said it a lot in this conversation and many other past conversations, but HR is so much more cost effective when you're using it proactively instead of reactively. And many people don't realize that HR is so much more than just hiring, firing, and performance reviews. Just the same as being a dentist is so much more than drilling, filling, and billing. So like you tell your patients, it's a lot more cost effective to keep up with your hygiene appointments every 6 months than it is to have major dental procedures done after ignoring your teeth for 5 years. It goes the same way for HR. If we can get all of this in place before you need it, it is so much easier to use. It is so much less stressful, and it's a lot cheaper in the long run too.
Yeah, it's very true, and it's funny that you mentioned that, because now that we've been working with practices in our COVID-19 recovery plan that we've developed to help them not only get everything that they need in terms of employee handbooks, occupational health and safety, and all of the 80 HR documents that we create for them, but once they see those documents and they see the policies and understand the systems, their stress level went from here down to here. And they felt like, okay, I've got everything. I've got the compliance side taken care of. My team feel at ease. I feel at ease. And that's the whole point of why we created this, to be able to really help dentists be dentists. And we take care of the actual HR management side for practice owners, so that they can, know that they've got the peace of mind, and they can just do what they love and be in their zone of genius day in and day out.
And I think that works for the office managers and the administrators too, because they're always just bombarded with all these tasks, and they have so many things to do already, that when it's like creating, however many pages of your employee handbook and your OHS manual, and then all of the accompanying documents, they can't. It takes forever. And right now we don't have forever. We need to get these things done ASAP.
We don't have forever. That's exactly it. That's why, I'm glad that you're helping me with this. And I have a pretty good idea. I sort of learned by osmosis, so to speak. But you know what? It's I'm glad that I can rely on you when I need anything. So thank you. I may get a little bit of a preferential treatment, but you ladies are amazing with all my colleagues as well. So I'll give you that. Well, listen, thank you for spending part of your day with me. I really appreciate you answering my questions. These are all legitimate questions that have been weighing on my mind, and you're helping me out. Hopefully, our listeners as well will help quite a bit. So thank you. Enjoy your Sunday, and I'm sure we'll be in touch again next week.
All right. Thank you very much. And I know, Olivia, we put you in the hot seat for that. So thanks so much for putting together all of those great words of wisdom and some strategies to be able to help practices when it comes to knowing what to do for reopening, or again, worst case scenario. My motto is, we want to hope for the best, but prepare for the worst, right? And that way we're ready to tackle whatever comes our way. So thank you very, very much for this. And if there's any questions, HR specific questions, like Olivia had mentioned, we are doing compliance audits. They're complimentary. So reach out to us to be able to help us not only help you navigate and create a strategy for reopening, but also make sure that your compliance is taken care of, all of your I's are dotted and T's are crossed, and can see how we can help. So please feel free to reach out to us. Thank you.